I class at the end of the session. We took the class over to Sweetwater Creek Park and took them on a hike.
Have this, considering all that's been going on over the past couple of weeks. We've seen a lot of change, a lot of good change, just seeing the rates of transmission drop tremendously. We've also have seen a change in the CDC guidance, and we still have this outstanding emergency order at the county, though we've removed the mask requirement. And so this meeting is very important to me, as it will help inform me, and I believe we have someone from our county attorney's office, how we formally end our emergency order, should that be consensus here today. In light of my time, fortunately I have a 10:30 meeting today that I'll be driving to, so I will be turning off my camera and just be participating in the meeting via sound. And so if there's any advisement you can help bring before 10:30, that would be wonderful. And in worst case scenario, if the meeting continues beyond that time and there's still, certainly significant information that I must weigh, Vanessa Drayton is going to be on the entire call. She's my chief assistant, and she will help close out the meeting for today. So with that, thank you. I'm going to turn things over to Cassie within Cobb County, and then we'll turn things.
Okay.
I would go ahead. I think she's breaking up.
Okay. Hi, good morning, everyone. Can you hear me okay?
Yes, we can.
Good morning. We are seeing a decline in our cases in Cobb and the Cobb government. I think we had 2 last week, and so far this week, none have been reported, so that's great. My team has been working alongside public health to get the rapid test kits delivered. We were able to deliver them to all the nonprofits that had requested them. And last week we had a rapid test distribution site, and it didn't go as well as we'd hoped. But we were able to strategize, Lisa and I on the scene out there, and we're able to get some out to a healthcare event that we're having at the epicenter, and we left some for the church there. So it was still a success. Tomorrow we'll be having an event at Piedmont Church from 2 to 4. So we'll be out there giving the test away. Hopefully that'll be a successful event. And with the remaining test kits, we were able to give the cities, all the cities received tests, as well as the food distribution sites. For the most part, most of them were able to get some. I still have about 1,600 on hand that we'll discuss on how to move forward with those, but I wanted to make sure we did have a few in contingency to meet any unmet needs at the end of this process. So hopefully we'll be able to be successful with those as well. And like you said, Chairwoman, we did lift the mask mandate in the county this week, which is good. And we seem to be moving in the right direction. So we're happy. Thanks so much, guys.
Great. Thank you, Cassie. Dr. I'll turn things over to you now.
Thank you. Good morning to everyone. Again, I'm Mary Chapman. I'll be representing Wellstar on behalf of Candace Saunders, our CEO, and all of our team. We have a number of other Wellstar partners and team members on the line who can help me if we have some specific questions. I think based on your comments, Chairwoman Cupid, I will flip what I usually do, and I'll save my sort of general comments until the end, and I'll go straight into the capacity update. Which gives you some numbers and some sort of more activity that's happening on the front lines. As of yesterday, Wellstar, we had 181 COVID patients admitted to our hospitals across the system. In comparison, last week we had 193. So consistent with what Cassie said, we also see a decrease in our numbers in our health system as well. Still, the majority of those patients are unvaccinated. That is a consistent theme, and I think it will always be a theme, which is why we are encouraging everyone to get vaccinated, including their booster. Of the COVID patients in the ICU, the last time we spoke, we had 47. Today, we have 25. And also, again, we still see our ventilator utilization continuing to decrease. We only have 14 patients that are COVID that are on the ventilator, which I don't think that I can recall us ever being quite that low. Interestingly enough, we still see our ICUs being very busy, and we see that this is patients of other comorbidities and typical just during this time of the season in the year, patients being very sick. From a Keystone and a Cobb specific, the last time a week ago, we were at 83 at Keystone, and today we're at 72. I just want to remind us that Keystone in the last surge has been as high as 240. So just, again, Chairwoman Cupid, to give you some perspective in terms of numbers. And then Cobb Hospital today is at 12. And a week ago, we were at 17. And in Cobb Hospital, we have seen numbers as high as 130. We see that we are starting to see patients come back into our hospital, perhaps who have delayed care to get their elective procedures and their surgeries. We are opening our doors. All of our operating rooms are open. And we are continuing to make sure that we provide that care safely by, again, continuing to delineate and separate those patients who are, have COVID. Our visitation, we are accepting visitors within our hospital. I know that always is a high burden and a high stressful time for our constituents in our communities. And so all of our hospitals are at least at yellow, which again means that we're accepting visitors to be with our patients. We also see our ED wait times, while not completely diminished, we see them going down. As we had our COVID patients, the required testing and the decision making in terms of admitting to the hospitals did create some backlog. In addition, I just want to say thank you to our local EMS and all of our partners. They have collaborated with us quite a bit to come up with strategies, adding staff to wall techs to be able to take care of those patients. Finally, what I'll mention is our staffing. That always has been questions and concern. That is our greatest concern. We are now beginning to welcome back some of our staff who opted to take a traveling assignment. Some of them didn't travel far. They went to Emory or some local hospital, and we kind of switched team members. Now we are welcoming them back. We try to stay connected to them because we knew that the market would soften, and we want them to know that they're welcome to come home. We're still focused on recruiting new staff, both experienced and new grads. This is the time of year, again, that all of our academic partners are seeing their students finish. We're winding down our state-supported staff. Remember that the state gave us some staff, and then also we had some National Guard, and they have gone back to their prior assignments. So organization, again, I think that we feel like, knock on wood, that we are outside of our peak and are seeing the numbers continue to go down consistent again, as Cassie just updated. With that, I am going to turn it over to Dr. Memark. I do see Dr. Hines on the line, and with that, Dr. Memark, you want to give us an update?
Great, thank you, and thanks for having me today. So I'm going to follow up all that good news with good news as well, and so it's always a pleasure to be able to say some good stuff on these updates. So right now we're looking at our 2-week case rate is at 152 cases per 100,000, and the percent positive of tests, PCR tests, is at 4.6%. Now that's going to be, this will be the last time you'll hear me mention these kind of numbers, because not because we're disappearing, but because we have new CDC guidelines and metrics that are being followed, and Lisa will tell you a little bit about that later. But our entire website has been revamped and to go ahead and allow you to pull those numbers up yourself. So you can do it for whatever county that you're in, and that's the CDC metrics. And so it will be based on other metrics that make a lot more sense. Lisa's going to give you the details on that, but you know, with the advent of, we're praying that this is turning more endemic instead of a pandemic, and you know, this is what we were kind of hoping for in a way, is having a yes, a highly transmissible version of this virus, but also a little bit less viremic, or not viremic, less dangerous, but also we have some built up immunity either from natural or from vaccines. And so we had a lot of people infected in the Omicron surge. And so we are hoping that's going to confer some immunity to us, because we, knock on wood, do not have another variant that is a threat to us right now. And so this whole surge in conversation is different than it's been in the past, because in the past we have had some stuff brewing in the wings, but this is one of the first times that we have not. So very good news. All across the state, all metrics have experienced decreases, and so that's great. Hospitalizations, as well as cases, as well as percent positives, all on their way down. And for the first time, we are seeing deaths come down as well. So that was the last metric that comes along in a surge, and so we're seeing that come down as well. So very, very good news. When we talk about variants, we also monitor those variants. When you look at the CDC website, you'll see the different variants and sublineages of variants. So Omicron is the one that has been dominant in our surge right now, and it kind of got split into its sublineage. But the two that we're looking at are the BA1 and the BA2. BA2 is that one, the sublineage that we're following, and it has increased a little bit, but it has not done the kind of damage that that BA1 and Delta did to us. And so it is good news. Modeling is showing that we probably have about 3.8% of BA2 in our cases in Georgia, and only 43 cases have been identified thus far. So very good news, and that's for Georgia. But we're currently around 2%, but they're modeling it to be at about 3.8 soon. The last thing I was going to talk about is the vaccines. And so let me just preface this whole thing by, it's very confusing. So my advice to everybody is to go to the CDC website. There's a beautiful chart there that will tell you kind of, you know, where you are and what you should do, and, you know, which vaccine you should get. And so the major changes that we're seeing is really through our children that are greater than 12. And so remember, 5 through 11 can get the initial vaccine series, but you can get the booster after 12. And so the recommendation for the booster after 12 is to get it between 3 and 8 weeks to have the booster shot to be given. That's after 5 months. Now, here's a little bit of a caveat, though, is that they're saying that you might want to wait a little longer, especially for adolescent boys, to get that booster shot, because although it is a rare chance of getting the myocarditis adverse effect. It seems the longer that you wait, the less of a chance that you'll have that. So, and this is a great time. I was just talking to my assistant about our own children and when we're going to get the booster shots. And she was talking about going ahead and getting the booster shot. And I said, well, you might want to wait a little bit because, we're at the lowest cases that we've had, right? And so if cases continue to go down, then I don't see the need to get the booster right away. But maybe if we have another variant that's on the horizon, that might be a good time to go ahead. Like if BA2 starts gaining steam, then maybe it's a good time to go ahead and get yourself or your child boosted up, because that confers a lot of protection for you at that point to boost immunity. So you have some flexibility in how to make that choice. So definitely it is up to you, but we try to give you the best information that we can. So you can stretch it out, especially for boys. That is probably recommended. So go ahead and go to the website and see where you fall in that. The one thing we know is you should definitely have your primary vaccine series. And if you have any immune compromised states or your immune system is not completely normal, go ahead and make sure you get that booster or even an additional dose, which would be a 4th dose if you're needed. So please take a look at that. And other than that, Lisa will cover some of our other stuff later. So thank you all, and let's enjoy the nice weather and some good news for a change.
Thank you, Dr. Memark. I see Dr. Hines. Dr. Hines, did you have anything to add?
Hi, good morning, everyone. Thank you. I'll be very brief. I first want to start out by thanking Chair Cupid for inviting me to participate in the Cobb African American Public Policy Forum last week. It was well attended by members of the community, citizens, and also elected officials. We had a robust conversation around health equity. And I just want to follow up on something that Dr. Memark said about how this is becoming more endemic. Number one, we at Wellstar Center for Health Equity are still deploying teams out to do vaccines, and that's important. But number two, as we pivot to this being more endemic, we're excited to do some of the work that we had initially started to do around health equity and addressing some health disparities, particularly in our county around food insecurity, around certain chronic illnesses. So more to follow on that, but it's good news for a change to hear. Thank you. That's all I have to say, Mary.
Thank you, and good morning to you. With that, I'm going to turn it over to Stephen. Good morning, Stephen.
Hey, thanks, Mary. Hello, everyone. It's great to see everyone and be in front of you. I'm happy to give a quick update around some of our community efforts. And just, again, I always start with being very grateful to Cobb Douglas Public Health for continuing to partner with us. We're still doing the East Cobb Health Park testing at that location. Very excited about that. The Wellstar Center for Health Equity and our Congregational Health Network are continuing their mental health initiative entitled Full Support. And this collective is providing behavioral health education, trainings, and resources at congregations across the Wellstar service area. And so, again, we always are appreciative to be able to share some of the exciting work that's going on across our community and for this body. We also have a perinatal care package program that we're doing in connection with Healthy Mothers, Healthy Babies Coalition of Georgia. And that launched on January 18th, and orders have been filled for January, February, and March. And so that's very exciting. A total of 450 care packages are being distributed throughout the state. Registration is going to reopen in April for additional requests, and we'll be distributing those as those requests come in. The second year of the Wellstar Mobile Market launched on March 3rd. Again, all of these programs are those assistance and additional community support as we still soldier through this pandemic and COVID. But the Wellstar Mobile Market, we've had our first market of this second year in Griffin, which will service Spalding County, and the mobile market events are going to run through June. And we're going to locate those in all 8 counties with a Wellstar presence. So very excited about the markets that'll be in the Cobb area. And so more information is going to come on that. We're very excited about that. That's also in connection with our surplus food recovery program, which is continuing twice a week at both the Cobb and Windy Hill hospitals. And that's in connection with our partnership with Gooder. And through that partnership, Wellstar has been able to donate safe surplus food to several local nonprofits, which have served 3,667 meals and diverted 4,400 pounds of food from landfills. And so just very excited about that partnership with Gooder, and then more to come with that. With March being Colorectal Cancer Awareness Month, I also want to mention that the Wellstar Center for Health Equity is going to be participating in year 2 of the Good Down There campaign with Cobb and Black Health, which will kick off next month. So again, excited about all the collaborations and partnerships that we continue to seek out in order to better serve this community. We'll be increasing the number of colorectal cancer screening kits that can be distributed from 500 last year to 1,000 this year. Lastly, the Community Transformation Program is underway. And again, that program is focused on the use of technology to increase access to healthcare, increase access to social determinants of health support for those communities experiencing health disparities. Very excited about that continuation of that program. And I know we've talked about it before here on this body, but again, just the continued support we continue to provide. As I've shared before, Wellstar is dedicated and will continue to be dedicated to providing relevant COVID community updates and resources. Many of those can be found on our website, wellstar.org/community/COVID-19. There you'll find all of our system level and hospital specific COVID data, the number of patients, along with vaccination percentages, and just any number of resources that you can still use as we reach that endemic stage, but as we still talk about COVID and have to deal with it. Again, I close the same way I started, just extremely grateful for all the partnerships we have with community leaders, elected officials, and particularly our partnership with Cobb Public Health. And just thanks to Dr. Memark and Lisa, just your continued partnership has really been a godsend for Wellstar, and we definitely value that relationship and want to keep that going. I'll turn it back over to you, Mary. Thanks.
Thank you, Stephen, and thank you for mentioning Colorectal Cancer Awareness Month. Just a reminder that again, that this is the opportunity to get all of the required and recommended screenings, and Wellstar has a strong team of gastroenterologists who are always available to support your care and to help make sure that you are taking advantage of your wellness plan. With that, I'm going to turn it over to Lisa Crossman.
Good morning, everyone. I'll continue with the information and the good news sharing this morning. So a couple of updates. As Dr. Memark mentioned, the CDC on February 25th released some new guidelines, and those are found pretty easily on their website, I would say. And they're really looking at having our guidance based on the rate of community spread in the last 7 days and the hospital's capacity in that community. And so those county levels are available across for any county across the nation, and you can click on that and see where your county ranks. They're separating them into low, medium, and high, and each of those levels has some related guidance for it. Across all levels, there is still the strong encouragement to get vaccinated and to get boosted for everyone who's eligible, to still get tested if you have symptoms. But after that, then some of the guidance changes about whether you should continue to mask or use other prevention practices. So Cobb County is currently at a medium level, and that means that we encourage folks to continue to get vaccinated and tested. We also will say for those folks who are immunocompromised or very vulnerable, that they would check with their healthcare provider about what other practices, such as mask wearing, that they should employ. But it releases some of the guidance for mask mandates or across the county masking. I will tell you that for vulnerable settings like hospitals and long-term care facilities, these guidelines do not affect them. They are leaving those guidelines in place, and the recommendations that the hospitals and long-term care facilities would kind of make those decisions for their own agencies. I will remind everybody that masks are still mandated or required on public transportation. So you will still, for now, see those mask requirements in airlines and trains and public buses. They have released the guidelines or relieved the guidelines over school buses and daycare buses to be consistent with those other school settings. We're working with a number of businesses to interpret these guidelines, particularly related to their policies and practices. So, for example, this week I've been talking with Judge Leonard and Robin Bishop about the policies and the practices related to the court systems in Cobb. We really are happy to provide that guidance for our local businesses, but do encourage them to go to the CDC website first. If they have tried to make it pretty easy and to interpret those for the particular settings that each business may be in. So I'll stop with that on the guidance and then just hit a couple of other updates. You may be aware that Jim Miller Park, we are ceasing testing there after this Saturday. We will continue to provide testing at the East Cobb Health Park and also at the South Cobb Epicenter. So, but the Jim Miller Park will end. Our volumes are still tremendously low, and we want to thank the county for their support for doing testing and to be able to keep the door open if we see another peak and need to ramp up testing. But we do feel like it's time to release that and allow some other activities, more fun activities over at Jim Miller Park. We are working on an interesting project right now with Georgia DPH to pilot 20 testing kiosks around the state. These would be test kiosks that would be accessible by our residents. It's for a PCR test, self-swab, dry swab test. A person would walk up, put their information in, they would get the swab, they would do the actual swabbing, put the swab back in the vending machine or into the kiosk, and our LTS partners who have been working with us out at the East Cobb Health Park and up at the KSU BrandSmart location, they would then pick up these samples every day. And the results, they process them as they have been, and then the results for those tests would be given back out through the patient portals like folks have been given in the past. So we're looking at a location in Cobb and one in Douglas. If we find around the state that these are utilized and effective in meeting demand for testing, then the state is prepared to lease about 200 of these and to place them across the state to be able to meet future testing demand. And our hope is that this would be a way to meet the residents' needs without having to constantly ramp up and ramp down mass testing drive-through sites. So more to come on that. I don't have locations yet. We're working on that, but as soon as we have that, we will be advertising those locations. We're also pleased that the Morehouse contract got signed, and we're working on recruiting our community health workers that will be deployed around Cobb County. And so they are currently recruiting for those positions through Morehouse, and then expect to go through training over the next several weeks and have those folks launched in Cobb County in April. Jasmine McLeod on our staff is serving as the liaison with Morehouse, and we're really excited about that opportunity to work with them. They've been doing this for many decades and have a lot of great training in place to make sure that those community health workers are ready to go when they hit the communities. And lastly, I would just tell you that we are continuing our mobile vaccination services across the county. We still have our partnership with CORE, still have our outreach teams that are being deployed. If you have locations that you feel like are appropriate for us to be providing all these vaccinations, we still welcome that opportunity. And I'll stop there and see if there's any other questions or if Dr. Memark wanted to cover anything else that I may have missed. Okay, thank you.
Thank you, Lisa. I did want to, before I turn it over to Brunessa, looks like you're going to be covering for Chairwoman Cupid. As Dr. Hines mentioned, health equity and all of the work that, we partner with our communities in providing. We at Wellstar also have taken a very strong position in terms of just diversity, equity, and inclusion in general, starting with our team members and, with the 25,000 team members that we have employed and the very sophisticated system that we have at Wellstar, but also extending out and connecting to the work that has already been started in the community. So we are always in the business of stealing people, and we try to go for the best. So we recruited a amazing leader from Cleveland Clinic, and she is getting to know people in our community and learning her way around Wellstar. And so I did ask her to join us this morning to listen in and to make some facial connections and name connections with some very important people that I told her that I get to hang out with on a Friday when we're all celebrating that it's the weekend. So on the screen, you see LaJoyce Naylor, and we're glad to have her at Wellstar. She is quite impressive, and we know she's going to do great things, but I really did want to connect a name and a face and ask that you all join us in welcoming her, but also if there are things that are in your space that that you feel like you could partner with her, please don't hesitate to reach out. LaJoyce, you want to make any comment?
Yes, thank you very much, and thank you for the opportunity for me to be here. I'm so excited to be at Wellstar, and I've had a chance to meet some individuals, and I'm looking forward to just being able to branch out and meet as many partners as I can possibly meet. You know, some of the work that we've done already at Wellstar, we're taking it and we're tying it into our overall diversity, equity, and inclusion strategic framework. And I'm sure I will touch upon many individuals who are even on this call to take a look at the framework, to provide me with some of your input. Our goal is to be best in class in this work. And I'm very, very confident that we will get there because I know that there's organizational readiness and we are going to be moving forward with a lot of initiatives that's going to help our caregivers or our team members to understand, you know, what it is to be an inclusive environment and what does equity mean, not only for our team members, but for our patients and also the communities that we serve. So thank you very much. And I do look forward to meeting you. Please give me a call and maybe we can meet for coffee or just have a conversation where you can continue to help onboard me into the system. Thank you so much.
Thank you, LaJoyce. Last two comments. I did flip my agenda, so I had a couple of additional updates. We still are challenged internally in our hospitals in regards to blood. And so Cassie, we need about 10 more drives. And we would like to encourage everyone to participate in any blood drives. And you can access the website at redcrossblood.org. Or the Life South website at lifesouth.org. And our Wellstar facilities are listed on both of those for scheduled sites to give blood. So we would welcome any volunteers. And then the last thing I'll mention, which is not again a new topic, is that we have seen, and I know all of us have, our impact on mental health. So just wanted to share as we draw a circle and embrace our team members. And how the surges have impacted them. We've done a number of things in Wellstar, including adding some wellness rooms across our system. I know Stephen talked to me this morning and said that he had shared it with many of you, some of those initiatives that we've done. So we're paying attention to the health of our team members, and we know that this has been a hard time, and we just want to continue again to try to help support their resiliency. With that, I'm going to turn it over to Vanessa Drayton, I love that name, and say on behalf of Wellstar and the amazing team that I love to work with here, good morning to you all, and thank you for this opportunity to share.
Thank you, Dr. Chapman, so much. And just on the behalf of the chairwoman, I want to first of all say thank you to each of you, Cobb Douglas Public Health, Wellstar, Cassie, and all the work that you all have done during this time. And just say thank you, and thank you. It's wonderful to hear, and I'm encouraged to see that the numbers are declining, and that makes it truly a Friday. Chairwoman wanted me to make sure that I thanked Dr. Hines for participating in the public policy forum last week. The discussion was robust and very encouraging, and just to see everyone engaged was just wonderful. So thank you. Welcome, LaJoyce, to Wellstar, and welcome to Cobb County. And, we look forward to continue to partnering with you and getting to know you better. And, I may take you up on that coffee. And Cassie, again, thank you for all that you do. Stephen, the update, and, Lisa and Dr. Memark, we appreciate all we've done during this time. So I will definitely share this information with the chairwoman. And that's pretty much all that I have. Thank you, Dr. Chapman.
Thank you all, and everyone have a great weekend.
Bye now.